Hello friends, welcome back to the healthcare today. Today we are going to speak about tuberculosis. Earlier we had made some videos regarding tuberculosis, but in this video we will be more detailing about congenital tuberculosis, brain tuberculosis, lymph node tuberculosis, and also what is the treatment of tuberculosis, what are the difficulties you face while treating tuberculosis, and what is the diet which you need to follow when you are diagnosed with tuberculosis. So tuberculosis, as I told you earlier, it is a bacterial disease. It spreads through the air in form of droplet infection. One TB patient, once he coughs, he throws crores of bacteria into the air. Once this bacteria reaches all the normal individuals who is in close vicinity to the patient, they tend to have an exposure. Now, around 90% of Indians have exposure to tuberculosis, but we only see around 10 to 30% of these patients developing tuberculosis. The reason for this is, for tuberculosis to turn into an active disease, you need to have immunocompromising conditions like diabetes, poor food intake, malnutrition, lack of sunlight, taking steroids or any chemotherapy medicines or any post-transplant patients. All these patients are at risk for developing tuberculosis. So, what are the symptoms of tuberculosis? Once you are diagnosed with, once you have a suspicion of tuberculosis, what are the common symptoms which you see in your patient are fever, loss of weight, and cough. Many times the cough is productive. So once there is a cough, productive cough, we send the sputum for analysis and we see whether the tubercular bacteria is present or not. Once you are diagnosed with tuberculosis, it is very easy to treat. We have government medication available free of cost. So the treatment duration for tuberculosis is 6 months when it is lung tuberculosis. After 6 months, we repeat the test and see whether the patient is responding to the therapy or not. Once the patient responds to the therapy, usually we stop the medicine after 6 months. Many times you see, apart from lung, other organs which are getting involved with tuberculosis. So as we see, you can see cases of GI tuberculosis, you can see lymph node tuberculosis, you can see bone tuberculosis, you can see brain tuberculosis. So all these other forms of tuberculosis apart from the lung, they require usually longer form of treatment. Especially in case of lymph node tuberculosis, we usually give for 9 months to 1 year. In case of bone tuberculosis, we usually give for 18 months. So once you are diagnosed with lymph node tuberculosis, once you can see a visible swelling or you can see a swelling in the ultrasound, what we tend to do is a FNAC, fine needle aspiration cytology. We put a small needle into the swelling and we tend to extract it and send it for the analysis. The microbiologist sees it under the slide and tells whether the bacteria is visible or you have other signs of tuberculosis. Once the other signs are positive or the bacteria is visible, we start you on anti-tubercular therapy. Now, apart from lymph node tuberculosis, the other common tuberculosis which you also see is the brain tuberculosis. What happens in brain tuberculosis is, apart from cough, weight loss and fever, you also see headaches because the meningeal layer, which are the coverings of the brain, they get infected. To diagnose this brain tuberculosis, we do CT MRI and also we take the cerebrospinal fluid which is present in the brain and send it for analysis to see whether the bacteria is present or not. Once we confirm the brain tuberculosis, we will put you on anti-tubercular therapy just like any other form of tuberculosis, but also add some steroid, because the whole point of treating this is you need to decrease the pressure on your brain. So the whole point of giving some steroid is to decrease the headaches, make you symptomatically better and give for time for the anti-tubercular medicine to act. So once you are diagnosed with tuberculosis, once you are given anti-tubercular medicines, what are the most common side effects which we see? So as I told you, the most common side effects are red colored urine because of rifampicin, and you also see some skin rashes. Earlier you lose weight and also sometimes your liver gets damaged in the initial part of the anti-tubercular therapy. So that's the reason why for the initial 2-3 weeks we ask the patient to come back, get the blood test, liver function test and see. Now if the patient is symptomatic, for example if the liver function is deranged, the patients may have vomiting or nausea. So once we see that it is correlating with the liver function test on the blood, so we tend to stop the medicines for few days and try to switch you on a liver sparing regimen which is helpful for the liver. After 2 weeks, once your liver is better, we again try to start the first line anti-tubercular medicines slowly. If you have a problem again for the second time, then we don't usually re-challenge the anti-tubercular medicines again. So we tend to give you liver sparing regimen. The only difference is you take the medicines for longer duration. Now what are the side effects? You can see, I told you, you can see initially you may lose hunger. Sometimes you can also see some peripheral neuropathy. You can see tingling sensation, paresthesias. That is the reason why along with anti-tubercular therapy we also give you some multivitamins to prevent this peripheral neuropathy. And there are other side effects which are not very common, but once you have those symptoms or any other symptoms apart from the one which I told you, you may consult your treating doctor so that you can assess whether this is happening or not. Some amount of joint pains can also be seen. Few people have problem with their vision because of ethambutol. So these things can be readjusted once you have any problem with them. Now, apart from having any side effects, what is the usual treatment course or what is the diet which you follow once you are diagnosed with tuberculosis? Usually in tuberculosis, we say that nothing is off limit. But once you are diabetic or once you are having any other comorbid conditions, please maintain your diet. But the other thing we do generally advise is a high protein diet, because in tuberculosis you generally lose weight, you require more protein to put on weight. So we ask you to take eggs if you are a non-vegetarian, and we also ask you to take fish and chicken. Initially we avoid mutton because, as I told you, anti-tubercular medicines have significant effect on the liver. So if you take more of red meat, there will be problem with the digestion, gastritis and all. So for the initial part of the illness, we ask you to avoid mutton. But once your tubercular medicines have settled well, then you can eat anything which you favorably like. For vegetarians, if you are unable to take egg, we will ask you to take dal, paneer, soup and soya whenever required, so that adequate protein requirement is met. And as I told you, if there are some transplant patients, always confirm with your transplant physician to confirm whether there is any drug reaction happening with the anti-tubercular medicines and your transplant drugs. So in those scenarios, you always make a watch, always tell your treating physician that my transplant physician said certain drugs cannot be given over such a dose. So you can always make them correlate and follow a proper treatment regimen. That is very important. We care about you.